I'm going to talk about the pneumatic tourniquet. This is the machine for the pneumatic tourniquet. There's actually two sides. You could do two sites for the patient, but normally you're just using one, and so I'm going to choose to use the red side. What you should do is protect the patient, and they have this little stockinette. There is some stockinette on the orthopedic card that you could put around the patient's arm or leg if you needed to protect them from any problems any kind of skin problems that they might get from this machine, because it gets fairly tight. Then this actually hooks into here. It snaps into here. This cuff. You can unsnap this here, and this snaps right into here too. Okay. The cuff goes around around the person's arm, the patient's arm, and and this one is way too long. So it should wrap around like 6 inches, but most of ours are a little bit too long, and then we have some really short ones for really small people. But anyway, then you can turn this on. Once you get this into place, you can turn it on. And it goes through the calibrating system. It self-calibrates. You should really put the patient's arm up a couple of minutes before you start the procedure to drain all the venous blood out, okay? So you put it up for 2 minutes, and you have their arm protected. And so there's only two parameters here. The first one is the pressure. So it defaults to 250 millimeters of mercury. So that's like a systolic blood pressure of 250. So that's pretty tight. What the rule is that you get their systolic blood pressure, and you find out when their pulse is occluded from their systolic blood pressure. When that's occluded, then you can go up 40 to 60 millimeters above that. So I'm going to change this and turn this down. Then all you have to do is, there's a deflate here, or inflate, I'm sorry, an inflate. And so the beauty of this machine that's cost $10,000 is that it'll keep it at that level, around that level of that I set it. Well, I set it at 100, and so it'll keep it at that, around that level for 90 minutes, okay? And then in order to deflate it, then you have to push deflate for about 3 seconds. So you push the deflate for 3 seconds, and it deflates. And so you need to document, that what your settings were. You need to document that the patient has a pulse afterwards, and how the patient tolerated the procedure. Okay. The second parameter is time, and so it defaults to 60 minutes. You could leave it at 60 minutes. Usually Dr. Otero is fast, or if you have an arterial bleed, they're going to go to the OR fairly quickly, so you don't have to worry that 2 minutes. They do say, though, that 90 minutes is the time when the tissue becomes most ischemic and acidotic. So it could go to 90 minutes, and that's when it's going to give you